5 Tips to Avoid Psoriasis Scars. Psoriasis is a chronic skin disorder that is marked by patches of intensely itchy and flaky skin. About 150,000 more people will be diagnosed this year. Of those, about 80% will have the form of psoriasis known as plaque psoriasis. Plaque psoriasis is caused by disordered immune signals that trigger skin cells to grow too rapidly during a flare. It is not contagious and can't be transmitted to others, but it often looks unsightly and is usually very uncomfortable, too. One of the most common lasting effects of psoriasis flares is skin discoloration. Changes in pigmentation occur because of skin cell inflammation, which temporarily destroys pigment cells called melanocytes. Scarring is a bit more problematic. On the one hand, there's a lot you can do to avoid it, such as taking good care of your skin during both psoriasis flares and quiet periods. On the other hand, the effect lasts a bit longer, at least in your eyes. Skin itchiness and general discomfort are the two things people most commonly associate with the disease, and it often starts out as no more than brief rashes over certain parts of the body that look like little more than dry skin. The condition is caused by genes, and is usually recognized by those in the medical profession as an inherited genetic disorder. Not everyone who carries the genes for the disorder will necessarily suffer from it, though, which is where environment begins to play a very big role. Get skin back into its comfort zone and limit scarring with these tips. Moisturize. Using emollients, especially creams with exfoliating acids such as lactic, glycolic, or salicylic acid, is key to reducing itching and scaling. Apply twice a day to achieve the best control. Apply cooling on the affected part. If itching is really driving you crazy, try a cool cloth or even an ice pack as an alternative to scratching. Itching a plaque of psoriasis can worsen a flare-up, which increases your chance of having skin discoloration when it subsides. Skip shaving during flare-up. Shaving with psoriasis can worsen areas of plaques and lead to scars, especially for people affected by the Koebner phenomenon, a reaction that causes new psoriasis plaques to form wherever you experience a skin infection or injury. Look for new treatments. Phototherapy and effective medications, oral, topical, and injectable drugs, can help control flare-up. If you're going through a particularly difficult psoriasis flare, talk with your dermatologist about new treatments to consider. Find your own information. If you aren't sure your current doctor is up to speed on psoriasis care, find one who is. Certain medications and treatment regimens can help keep flare-ups suppressed, though, and can dramatically alter patients' quality of and enjoyment of life. Find your own information. Visit the website http://viralwebsite.net.
I hope you enjoyed our review. If you would like to order this product or see further details, then simply head over to the website address you see on the screen right now.